Shabir Madhi, Wits Professor of Vaccinology, has bemoaned the fact that people over 60 and those with compromised immune systems have not received booster shots. He joins us now to tell us why. Professor Madhi, please, if we can pick up on your thoughts as to why it is you're dissatisfied with this delay.
So what we know about the Pfizer vaccine as an example is that even though it's continues protecting against severe disease in people above the age of 65 and those that are immunocompromised 3-4 months after they've received a second dose, that protection is reduced from about 90% going down to about 75 to 80%. And that protection can be enhanced by giving the third dose of vaccine. Now, for South Africa to delay the giving of a vaccine whilst we're in the midst of resurgence and only to really offer the vaccine probably by the time this resurgence has passed will simply be a wasted opportunity. More so since doses of vaccines are available in the country and are currently lying in the depot. So without any question, the vaccine, the booster dose should be provided to those groups immediately if they've received the second dose of vaccine 3 to 4 months ago, rather than waiting months after the second dose of vaccine. In addition to which, the Johnson & Johnson vaccine is not a single-dose vaccine. It performs actually very modestly compared to other vaccines, protecting even against severe disease as only a single dose. So it's absolutely necessary that everyone that has received a single dose of the Johnson & Johnson vaccine immediately provided another dose of the Johnson & Johnson vaccine or the Pfizer vaccine. And this is a recommendation from the WHO, which itself basically has indicated that a single dose of the Johnson & Johnson simply is not complete immunization, and that you do require the second dose either of the J&J vaccine or the Pfizer vaccine.
Right. Dr. John Nkengasong of the Africa CDC, in a briefing on Thursday, when asked about this question, said that, you know, now is not the time perhaps to worry about booster shots when we haven't even reached the levels of vaccination that we'd like to have ideally reached.
Yeah, so we're talking about different types of booster shots. What happens in high-income countries is they indiscriminately using the dose of the vaccine. For people that are not really at risk of developing severe disease, but they're trying to protect these individuals against infection, mild COVID-19. And I certainly agree. Under that sort of scenario, the complete waste of doses of vaccine to be giving booster shots indiscriminately rather than using these vaccines for settings that haven't been able to access vaccines. So I'm not advocating for liberal use of the doses of vaccine. It's very targeted and specifically targeted to those that are still at risk of developing severe disease despite being vaccinated.
So according to the World Health Organization, the continent is receiving some 20 million vaccine doses a week, and some of these donations have a very short shelf life. Is it safe to say that perhaps governments are under pressure to then use these vaccines and get the shots in people's arms?
Yeah, so it's really unfortunate that African countries are being provided vaccine that expires in a matter of a few weeks, because that lends itself to a lot of wastage, and that needs to be sorted out by the public facility, as well as those governments that are making those donations, because they're waiting until the end before they make those donations. So if that country is not going to be able to ramp up the vaccine coverage of the continent because it is higher planning, and it requires sort of stability in terms of supply of vaccine, as well as timelines before the vaccines expire. But African countries as well need to be more involved in terms of sorting out the logistics to ensure that when vaccines arrive in the country, they actually deployed and get into the arms of people. Because early next year, we're going to have close to 1 billion doses of vaccine that probably will become available to the African continent. And the challenge then, as we experience in South Africa, is not about how many doses of vaccine got in a country, but rather being able to get at the arms of people as quickly as possible.
As the country mulls the issue of vaccine mandates, a country like Ghana, for instance, news coming through, the latest on that is that they have implemented, a vaccine mandate. So if you travel to that country, you must show proof of vaccination. I'd like to get your thought as this issue is widely debated in the country.
So certainly in the South African context, a strong case to be made from vaccination. And it's not about individual rights. It's about the rights of every citizen in South Africa protected in all aspects. So we do know that vaccines firstly do protect against infection, and people that are infected, when vaccinated individuals are infected, they're less likely to transmit the virus. That might change slightly for the Omicron variant, in that with the Omicron variant, many people are still going to experience breakthrough infections. Things might not work too well against infection. But another dimension to this is when people are not vaccinated, and when they end up in hospital and put pressure on the hospital, government then ends up imposing higher levels, and that has got a knock-on effect on the economy. And that eventually ends up in the livelihood of people. In addition to which, we put undue pressure on health facilities that could otherwise have been avoided had people been vaccinated. So it's more than just our infection, protecting against infection and transmission. It's also the consequences that are materializing when hospitals become overwhelmed, large was unvaccinated people needing to be admitted, and then government start going to higher level.
Thank you very much for your time this afternoon. Wits Professor of Vaccinology, Professor Shabir Madhi.